When it comes to our health, it is always best to be proactive. We can all take steps to try and prevent a major illness by getting regular exams and key tests, and that's especially true as we get older. So once you reach the 50 mark, where should you start? Our Dave Metzel went to the doctors with OhioHealth to get some answers.
All right, I'm over 50. I'm at the doctor's office. That's the good thing, but I'm a little nervous about it. Is it going to be the cotton balls, the tongue depressors, one of these things, or heaven forbid, one of these things? Bottom line is, it doesn't make any difference what the doctor tells me. The important thing is that I'm here and I'm going to get a chance to meet the doctor. In fact, here's the doctor now, Dr. David DeWalt. How are you?
Good to see you.
Good to see you as well.
Glad to see you here for your physical today.
That's important. Dr. DeWalt and OhioHealth would like those over 50 to make an annual checkup a top priority. Even if you feel good, eat right, work out, and buy into the theory that 50 is the new 30, you still need to get regular screenings that may not have been quite as vital when you were younger.
There's a lot of things going on that you may not, even though you feel good, unless you get it checked, you may not know that things are going on without coming in for a routine screening. And there are certain things that are recommended so that we can pick things up, because even your doctor can't tell unless things are checked.
So diet and exercise are important, you knew that. But when it comes to potentially life-saving screenings, Dr. DeWalt recommends the following.
At 50 years old, there's certain things that are absolutely recommended, and that would be a colonoscopy at age 50 to screen for colon cancer. It does depend on your family history, which you may need earlier, but at least at 50 you need a colonoscopy to screen for colon cancer. For men, absolutely a prostate exam by age 50. Certain populations need it earlier than that, in their 40s, but most people, at least by 50, need a prostate exam, which includes an exam in the office plus a blood test to screen for that as well. Those are the two big ones that are strictly at age 50. Most people at 50 should also be getting their cholesterol checked, their sugar checked, kidneys, and those are done by a blood test. And there's also certain recommendations for immunizations, which would be flu shot on a yearly basis. Certain populations need pneumonia vaccines, and then the new one that's sort of come to the forefront here recently is a tetanus shot. And the new tetanus shots have whooping cough protection or pertussis protection in it again, and we're seeing sort of a resurgence of whooping cough nowadays. And so we're trying to get everybody updated on those.
Family history is also very important and something everyone should talk over with their doctor.
That's part of your physical exam. We go through your family history to see what things do run in your family. A lot of diseases do tend to run in families and are genetically inherited, so that does change a lot of your recommendations.
OhioHealth also recommends you don't wait until something is wrong to see your doctor. It's much easier to correct an issue if you get to it before it becomes a problem.
Usually in any disease state, if you can treat it earlier, you tend to, it's an easier treatment, it tends to be less severe, it tends to be less costly. And so that's the whole reason for preventative medicine, doing these screening tests, is try to pick things up early.
The doctor says in general, 50-year-olds are healthier and more fit than ever before, but it's because they are paying more attention to a healthy lifestyle and getting to the doctor regularly. Don't wait until you're sick. Schedule an exam every year.
It's hard when you come in just for an ill visit for you and your doctor to focus on screening exams, and so that's what really makes it important to come in for your yearly physical, so these things can be addressed when you're there.
All right, good for another year. The next move is yours.
You got it. Thanks, Dave. That's advice we can all follow. The preceding portion of Daytime was sponsored by the G. William Parker, MD Fund for Health Education through the Grady Memorial Hospital Foundation.